This is Dr. Abdulghani. Hope everyone is enjoying their time at home. I just wanted to share with you guys some of the things that is exciting at Mediversity Health. We here have a more comprehensive weight loss program at this time. So what you are going to be asking, what do you mean by a more comprehensive weight loss program? So a lot of times when you go to a weight loss center, they are going to take your history, they are going to give you a paper for what you need to do with your exercise. They will give you some recommendations for medications. They will tell you to come back in a week or 2 weeks or a month or whichever way it goes, and make some suggestions on how you can lose the weight. At Mediversity, we have a package which is much more geared for everyone, no matter what your age, what your background is, what your conditions are. We take it to the next level. So when you do come in for the first visit, we do have a special at this time. When you come in for your first visit for the weight loss program, what we are offering is something special. What are we offering? That is the question. What you do when you come in, you fill out a comprehensive history of what your journey with weight gain is, how did you gain that weight, what your medical conditions are, how long have you had those medical conditions, and then we offer to do a comprehensive check in two main ways. So first thing which we do is we do blood work for you, where we are checking a complete metabolic panel. The second thing that we are doing for you is checking your lipid panel. The third thing which we are doing for you is checking your A1C to see if you have diabetes. The fourth thing that we are doing for you is checking to see if Amy, hello Amy, I would invite you to join us. The fourth thing that we are doing for you is checking your blood count to see if it is high or it is low or where it is. So that is number one. Hey Amy, how are you? Welcome to Mediversity Health. How have you been? So I was telling everyone about our weight loss program and the importance of being part of the weight loss program, and what is this comprehensive weight loss program. So can you say a few words about that?
So the comprehensive program is actually having some routine lab work done. That way we could see where we're starting with and see if anything needs to be adjusted prior to actually starting them on one of the supplements, and to know which supplement's going to be best for them.
True. And that is important. Like a lot of people that are doing weight loss, they are not getting their baseline lab work, and that is a huge problem because they don't know if they have high potassium, low potassium, if their kidney is working, their kidney is not working, if they have any liver issues or they don't have any liver issues, how they, if they are diabetic or they're not diabetic, what is their lipid panel, what is their blood count, if they're anemic or not anemic. That's why it's important, just the basics, but it's a comprehensive basic. That is important. The second thing which we do is, one thing which is critical is called a EKG. So what is a EKG, Amy? Like, why is that important?
Tells us the rhythm of their heart, whether or not their heart can actually sustain the medications and the supplements that we put them on. Some people, some of the supplements can actually cause more interactions with their heart, can actually.
Yeah, so that's why it's important that when you do this weight loss, at least you get a basic rhythm of your heart, so you are able to. Hey, Dr. G, how are you? Welcome to our podcast. This is a live podcast that we just started. I'm so happy that you are joining us also. So, what can you tell us about the weight loss program at Mediversity?
Well, the weight loss program here is fantastic because we hope for so many different methods of losing weight. And that it means it's a very individualized program. So you come in and you are given a personalized profile to determine your best method of losing weight.
True.
And I can tell you from the experience, we've had tremendous success here. I would say to you, Dr. Abdulghani has organized a program. What is the weight loss number of pounds that you've seen in your program, Dr. Abdulghani?
So I think, like Dr. G, you really mentioned a really great point that what we are seeing is like when people are coming to us, they are doing it in a safe way because once they're coming to see you or coming to see us, we are keeping an eye on their blood pressure. We are keeping an eye on their vitals. We are looking at it in a much better way, and people are losing every week. Like some people are losing 3 pounds, some people are using 1 pound, some people are losing over a month like 10 pounds. So that is the thing, like it is the journey and it is the way when they're doing it in a safe way.
That's absolutely correct. And I've seen just what you've described. I've seen the weight loss can be from 7 pounds to 40 pounds. And people are very happy with this program.
Mm-hmm.
The other thing I call it is there's pharmacologic and non-pharmacologic approaches, which means even after you lose the weight, you want to maintain that weight loss.
True.
And that's another method of what we offer here at this program.
Yeah. And I think you have a good point. Like the thing is, it's not just the losing the weight, it is maintaining it also,
Definitely.
which is very, very important. And that is one of the things which I don't know, like if you mentioned is like we do have behavioral health specialists up here. Part of the problem with weight gain is related to behavior and stress or anxiety or stress eating, and that is something which not anyone has even talked about or has been able to address.
That's absolutely true. And we see a lot of pressure in today's society. And I've seen a lot of weight gain after pregnancies. They call that gestational pregnancy or gestational diabetes. And that is another interesting point to bring up. And as you know, Dr. A, during the pandemic for COVID, there was a lot of people who stayed at home and just continued to eat due to the stress levels.
Yeah. And I think part of the thing is like a lot of people with stress or all that, it does affect their other neurohormonal conditions, their stress levels, their hormone levels, and that is one of the things which we haven't even touched about, and maybe one other session we can discuss that, where we are able to do cortisol levels, where we are able to do hormonal levels and be able to provide that. And like the main thing with anything with like is doing it safely, because a lot of times I hear like people buying things online for weight loss or buying things that are not prescribed by physicians or doing it unsupervised. I'll tell you one last story, which is a lot of people are trying to gain like using protein shakes and other supplements which are not regulated, and they end up having kidney problems or renal issues after they're doing the weight loss
We're
program.
getting a lot of issues with people buying supplements off of Amazon that have more added sugars than anything, and they can't understand, why am I gaining weight?
Yeah. Anyway, I think you have a good point that you have to do it in a safe manner, and the only way you can do it in a safe manner is when you are able to do it by a supervision of a physician. So that is very important, and I think this is a conversation for us to uh, go in depth with and be able to address that. And I think at Mediversity we do it in a compassionate way, and in a legitimate way where people can benefit from that.
True.
So anyway, so Amy, if anybody wants to join the program, what should they do?
Give us a call.
What's our
Check
What's
out.
our
They
number?
can
Huh?
they can call the Mediversity weight loss phone. That's 856-323-3317.
Or the main
They
number?
can get the main number is 856-740-9777, or they can go on our website at mediversity.com.
Okay, so I guess everyone go to your phones right now. The operators are waiting to pick up your phone. If they don't pick up right away, please hold and we will be with you in a few minutes. Again, we are at Mediversity Health. We are here to help you lose
And
weight.
we have
And
offices.
we have 2 offices, yes. Do you know what the address for the 2 offices are?
4991 Route 42, Suite 8 in Washington Township. The second one's One Pointers, Auburn Road in Mannington Township.
Okay,
Both
I guess that is something which we can always share. I thank everybody to tuning in, and we look forward to hearing from you soon. Happy New Year and happy holidays and happy Thanksgiving to everyone. Okay, take care.